Good afternoon, everyone. I'm Barbara Porter, and I'm so thrilled to have you joining my session today. We're going to be talking about media advocacy, and I know some people will be sort of joining in and out, but as I start my presentation, just a couple reminders. I have two moderators with me today from CSM, Jennifer Van Corey and Lisa Creason, and they'll kind of be helping me navigate between the Zoom and the Whova. We've got two polls in there right now. So if you can take a moment, our first one is about whether you think the media understands nonprofits. And the second one is more focused on social media, which will be the second part of our presentation today. So if you can take a moment at any time during my presentation to answer those polls. I've also got some discussion questions that we're going to be using to get some interaction with the group today. If you can use the Q&A to type in your name so we can call on you and then unmute. And finally, at the end, when we're done, we just want to remind everyone that it's really helpful to get feedback. So after the session is over, don't do it during because it'll kick you out. Please go to the surveys and rate this session, but also rate the conference. I don't know about everyone else, but this morning I was in two sessions and they were just very interactive and very informative, and it's been a great day so far. So right now I'm going to get started and I'm going to share my screen. All right, nonprofits and media advocacy. And first, just a little bit about me. My name is Barbara Porter, and I like to tell people I'm a recovering journalist. I have recovered from that profession after 25 years, and then I went into higher education through communications and marketing. And currently, I'm very blessed to be at the College of Southern Maryland, helping the health department with the CARES Act grant around COVID-19 awareness. So I do sessions on nonprofits and media advocacy, mainly around health issues and public health issues. But what we're going to talk about today applies broadly across the nonprofit sector. So what is media advocacy? Well, it is the strategic use of the media to advance public policy initiatives. It can be local, it can be regional, national, or international. And it does have roots in the public health community. And it is widely used by nonprofits to really achieve visibility and improved outcomes. Today, media is plural for a reason. There's so many forms: radio, TV, print, newspapers, magazines, newsletters. But the explosion has really come over the past 10 years in the internet, social media, digital media, everything. So when you think about media advocacy, you have to think about the multiple platforms you're dealing with. You also have to think about how they evolve and how you use them. And of course, advocacy is openly supporting a point of view, a group of people, your mission, your vision, and your cause. So we're going to go to our first poll, and this is just to get a baseline understanding of whether you think the media understands what nonprofits do. So I'm going to give you a quick second if you haven't already answered that poll, to please do so. Does the media understand what nonprofits do?
Okay, 71% said no, 29% said yes.
Okay, that's very telling. And that's why I wanted to ask that question as we started our discussion today. If you don't think the media understands what nonprofits do, then you need to educate the media about what nonprofits do. So a lot of times you're in that space where you say, well, the media doesn't understand me, I can't get coverage, I can't get my points across. So that's what we're really going to be talking about today. Building understanding in the media of nonprofits so you can advocate for your nonprofit, your mission, your vision, your cause. So the framework for media advocacy is really focusing on and embracing your issues, changing minds, creating consistent messages, and we'll talk a little bit about messaging later, identifying appropriate messengers, finding community champions, building relationships with the media, because it is about relationships. Yes, we don't have a consistent news presence here in Charles County, but building relationships with those who cover Charles County is really important in how we advocate as nonprofits. And then finally, motivating the community and policymakers. So you use media advocacy, obviously to inform and to educate and to create the narrative, also to open a dialogue, because media can help you open that dialogue with the community and reach groups that haven't been heard before. And also, I think the media can put a magnifying glass to your issues and also help you creatively with solutions. And it also encourages involvement on many levels. And you'll hear me talk about this a lot, but creating partnerships. I've seen a lot of nonprofits work not only with community members, but with other nonprofits to really create an open dialogue around similar issues. Why would you want to engage with media? Big bad media, why do you want to engage? Obviously, the media has access to the audiences that you don't have access to, different audiences too. They're your bullhorn. They can amplify an issue. They can get the attention of policymakers and the public a lot more quickly than you can at the grassroots level. And why does the media benefit nonprofits? Well, you don't have a large advertising budget. Traditional advertising for nonprofits is almost out of reach budget-wise. So media outlets and getting, as we called earned media, which is free coverage, is really an inexpensive way to be in the public eye. And policy makers, like it or not, they pay attention to media coverage, good or bad. I would say if you want action, you can bring it more quickly with media notoriety than with just plain community engagement. At the end of the day, really, nonprofits and media are good partners in educating community and raising awareness. And the media is really a valuable ally in disseminating critical information, especially in times of a crisis. And that has been proved through COVID-19. Can't think of a better example of how working with the media helped educate communities in a time of crisis. We want to talk about sustainable strategy. And part of that is understanding that when you educate the media, and it is you educating them, they do want to get it right. I know a lot of times people are concerned because they think I'm going to get in that gotcha moment. The media is going to get me, they're going to get it wrong. You need to be working with them to get it right and working with them on correct information, which means you have to have the correct information. You can influence the media. You have a lot more sway over how their stories go and how they're perceived because you know your case. You can build partnerships with the media. The media does like to be involved with community issues, and you can empower communities through the media. Communities feel a lot stronger when they work with you on their issues and through the media. And you can pressure policymakers through the media. This is the big, giant power of persuasion that you have by using the media. But a lot of people say, well, when should I engage with the media? What's the right time? Well, I always say this, when you're ready. You have to have your messages and your messengers prepared. You need to elevate a legislative push. That's a good time to get the media involved. When you think your issue, your nonprofit issues dovetail with a national news story, obviously great to engage when you're announcing a new fundraising goal or a new project, when you've come to a certain milestone, or as I mentioned before, when your issue reaches a crisis. So I want to get you guys involved in the discussion. The first question I have to throw out to the group is, what has been your biggest impediment in engaging the media? It's probably going to work best if you put your name in the Q&A, and then Lisa will call on you. And then when you start, just give me your name, your nonprofit, and a brief answer to this question. So Lisa, who do we see popping up in the Q&A?
I don't see any brave souls.
Oh, come on, I need a brave soul. What has been your biggest impediment in engaging with the media?
I'll jump in here. How about knowing who to contact or how to contact them?
That's a really good one because right now newsrooms have a really high turnover rate. And it's very hard to get to the person who's covering your particular area or your particular issue. In the golden days of journalism, everybody in every section had a reporter. For example, there were health reporters, there were economic reporters, there were regional reporters, and you knew who to go to. And right now it's really hard. So your challenge is to really do your research and to find out who's covering your particular area, to look at news coverage that's been done on the local, regional, and national level for your issue. So for example, if it's the empowerment of girls, who's in that space? Who's been dealing with these things?
Yeah, and Yolanda echoed what you said is we have really small media outlets and high staff turnover.
I think another impediment too is just because of the low staffing, reporters are reluctant to get involved in an issue without a lot of pre-briefing. So the more that you can pre-brief them on your issue or your nonprofit, in other words, don't wait until you're trying to launch something to put something before them. They will file information if you give it to them, and you come back to them and say, oh, I'd really like you to cover our new center. We're opening it. If they knew about your nonprofit before, it's a lot easier to get coverage if you've been in their eye before.
I'm Debbie with Sleep in Heavenly Peace.
Hi, Debbie. Thanks for jumping in.
And I'm very happy for the most part with our media coverage. I liked how you said you have to create your own narrative. And advice that I was given was you need to write the story for them sometimes so that they're overwhelmed with the amount of work that needs to be accomplished. And if you're new on the playing field, then they don't know you. So you have to do some of the legwork for them. I have had difficulties with just one outlet of I've written the story. I've gone to them. I've, 3 or 4 times and I just haven't found the in yet. But other than that, I've been very happy with the local coverage that I've asked for and received.
That's great. And we're going to go into a little more of what Debbie said very profoundly about how to make your case and write your story. Another thing that I found, especially locally, is sometimes you may know people who know people. So you may leverage a connection in the community through your church, through any group that actually knows somebody who works on the paper. And that might be an in. So I always say connection, connection, connection. Trying to find the media connection can often be through other connections. So I appreciate, and again, if you don't find it comfortable to go into the Q&A to enter something, or you can't see it for some reason, just unmute and get my attention, and we'll have this discussion.
This is Rose. I want to know when to get in touch with them. I seem to get in touch with them too late or too early.
Well, I always say it's never too early. And what I mean by that is, and we'll go over some of this, but you need to make the media aware of your organization and what you're doing long before you need them. So to educate them about what you're doing, even if it seems like you're sending a bunch of emails and you don't get any response, I say the earlier, the better. If you're just starting, jump in there and announce you're just starting. If you've reached a milestone, send them that. Then when you really need them, they'll say, oh yeah, I did get something from you guys. Oh, okay. So I always say earlier rather than later, but we're going to talk a little bit about how to navigate their logistics, their deadlines. So
Barbara, here's another question from Melanie. She says, we are a new nonprofit, so it's challenging for them to understand who and what we're doing because we're so new.
And, that is the point that I think is really important. How do you there's a lot of nonprofits, particularly in Charles County, that have been around forever. And so when they ping the media. It's, oh yeah, I know about lifestyles, or I know about this or that. Starting a new one, your challenge is really to build up the education of the media. And part of that can be done, and we'll talk about this a little bit later, Melanie, through social media, through creating your social proof, through creating your accounts that are monitored. But I would say, as Debbie pointed out earlier, get your press release ready, find out who the people are that cover your area, and try to do it consistently and early. So,
Here's one more.
okay, sure.
From Mia. She says she's from Community Mediation SMC, and she finds herself not thinking that they have anything newsworthy.
You know, just the title of your nonprofit makes me think it's newsworthy. I mean, your organization has a mission, has a vision, has a cause. You need to articulate that within your group, and then think about what are the external messages that you want to get across to your community and how the media could amplify those messages. And it could be as simple as people need our service and why. So you may not think it's newsworthy, but your organization, your goals may dovetail with something or some trend that's going on beyond Charles County or beyond the Tri-County area, that might be regional, that might be national. You have to look for those trends. But I think every nonprofit has newsworthy items that they can share. They just need to understand how to do it. So let's talk a little bit more about that. When you work with the media, you do need to establish those personal relationships. And I think somebody said, is it earlier or later? One of the things you have to realize is you have to be available. You have to do the legwork for them. You can point them to the angle of the story. You need to be accurate. You need to be telling the truth, because they will, in most cases, fact check, we hope. And you obviously need to alert them to stories that dovetail with your organization's goals, etc. When you work with the media, have a clear agenda. What is your agenda? What do you want to achieve with this particular media interaction? You got to present your agenda to the media. And what I like to say is, if you can prepare educational briefings ahead of time. So for example, Melanie talked about her new organization. What's the best way to get in front of the media? Create a toolkit, create a press package, which is an educational briefing. That would include your storytelling, Melanie. That would include facts and figures on your particular issue. And then, as Debbie mentioned, write the press release. Write the press release. Also, give them an idea about what your solution looks like and get the conversation going, and then create events for them to come to. And you're going to create an event to introduce your nonprofit, or an event in the community that highlights your nonprofit. And maybe the first few times they're not going to come, but they will come, because it's easier for them to go to an event sort of one and done. And so I always say, create the event. If you build it, they will come. Let's talk about messaging. Media plus your grassroots campaign equals success. And you need to make sure that the public, after you've gotten media coverage, sees that coverage, so they can buy in. And you need to be patient. It does take time to build these relationships. And think about all the various channels that you need to open to be in the public eye. So again, it's not just, in the old days, we had the Washington Post Southern Maryland section, which we don't have anymore, but it's not just about that anymore. It's about social media and your Facebook and your Twitter and your LinkedIn and everything else. And use authentic voices. What do I mean by that? If you're telling a story about homelessness in Charles County, as the head of an organization dedicated to eradicating that, and a spokesperson, that's fine. You can give some facts and figures, but somebody who's actually experienced homelessness and been helped by your organization is a far better storyteller when you're trying to make that pitch to the media. And then the other thing to think about is tell the media how they can help. So a lot of successful media advocacy happens when you go to your media outlet and say, look, here's our issue. We're going to have some people writing letters. Can we agree that you'll run 2 letters a month for us? And can we get our nonprofit CEO to write an op-ed? And you think that's not going to happen, but in a lot of cases it does and has been successful. How to get in the public eye? Obviously, there's media coverage. You can work with your local media on public service announcements. I know there are a lot of radio stations, especially during COVID, that have not charged for announcements that nonprofits have made. There are social media and Facebook. Obviously, of any budget, you might want to use some advertising, press releases, press conferences, and events. I want to give you a little idea of sort of where media advocacy came from, and it's a case study that came out of Oakland, California in the 1990s. The problem was alcohol and drug-related crimes in poor neighborhoods. So one nonprofit dedicated to children proposed a solution, a 1-year moratorium on adding any new alcohol stores in poor neighborhoods. That sounds like a pretty impossible task. So when first confronted with the ability to make this happen in city council, the nonprofit looked around and found a coalition of 42 other groups that really bought into this. And they had 8 weeks to organize a campaign. Back then, it was extensive media awareness, TV coverage, letter writing, and op-eds. And they found authentic voices, mothers, single mothers in poor communities worried about their children walking by the alcohol outlets on the way home from school, about the violence. So they achieved their goal. In these particular neighborhoods, they had that 1-year moratorium. But here's what we're talking about today. How do you sustain that? They knew that wasn't going to fly going forward. 1-year moratorium, that's all they were going to be able to get. So what did they do after that? They worked with the alcohol outlets on a massive awareness campaign and were able to sustain results and sustain that coalition as they worked through the issues related to that campaign. When you build a media advocacy campaign, it's not just getting media coverage, it's really mirroring a political campaign. If any of you have worked on one, it's preparing and deciding what's your objective, ensuring that everybody in your organization is on the same page. You need to identify who your spokesperson is. Is it your CEO? Is it somebody else in the organization? You can't have multiple voices trying to tell multiple stories. And listen to the community to discern what are the sustainable messages and who are the community representatives that could mirror what you want to say. And obviously establish those toolkits that we talked about earlier. You need to plan and make sure you have adequate resources to do this and look for windows of opportunities to launch. You always want to see what else is going on before you start something. And determine your start and end point. So what's your timeline? And then you need to regularly engage with the media during this campaign, and you need to think about your messages along the way. You may find out that some of the stuff you've been talking about, just doesn't resonate. So you need to identify your target audience, find your champions in the community, and think about your partnerships. Is there another nonprofit that you want to work with that would be helpful? Employee surveys or polls during your campaign. That's really important. You need to test your messages. Testing is really important because you may need to adjust. And you need to take the community's temperature frequency. How are they responding to your messages? Has any action happened? You may be feeling that you're getting nowhere, but if you're really talking to community members, they may have a different view. And don't stop. once you've started, don't stop, but be flexible, be ready to pivot. So when you set the agenda, who needs to be reached? At what frequency do you want to reach them? What's the result? What does it look like if you're successful? What is that? You need to know exactly what you want to achieve. And then what happens after? So sustainability and media advocacy really means keeping your nonprofit, your issue, your cause in the news, even when you've finished an advocacy campaign, even when it's not a crisis or not a crisis issue. I'll give you another case study, and this is from my experience at GW Medical Center. So as I mentioned, I do have a lot of health related background, and our nonprofit was the GW Cancer Institute. It was more of an education arm of the medical center. And what we found was that more African American men were dying of prostate cancer in Washington, D.C. than anywhere in the country. So what was our message? Our message was early detection equals better outcomes and lower mortality. What was our audience? When we sat down and thought about our audience, we said, well, duh, we have to reach the men. We have to tell them they have to get tested. But then we thought about it again. We talked to the community, and we realized that a lot of men in this community were very influenced by two things. One, the women in their lives, and two, their churches. So we then determined that the messengers should come through the church. So we went to African American led churches, and we worked with ministers in motivating screening, even using some of their facilities for screening. And then we decided, let's use a local sports team. So we enlisted, I will call it the Washington football team now because I need to be politically correct, but you knew them as the Redskins. We enlisted the Redskins, and we got a good result. Screenings in 2006 jumped 30% after a sustained campaign. And then we got a very unexpected outcome. We got a partner. The next year, the National Football League, and James Brown, noted football player, joined our awareness campaign, our advocacy campaign, and did this on a national level. And our spots ran during the football games during the NFL season. So it's just an example of how a really sort of focused campaign started, and how we thought we knew how to message, thought we knew how to engage, and we really changed along the way by thinking broader, by thinking differently, by listening to our community, and then by thinking about creative ways of enlisting partners in that campaign. The message is as important as the messenger. And what I tell everybody is develop a tight script. What is your elevator pitch? If you were getting in the elevator with somebody and you had the 60-second ride to tell somebody about your nonprofit, how would you do it? I always tell people, stick to a few key stats. If you go with all these different percentages and statistics, people just sometimes glaze over. So what is the main statistic that you want people to know? Avoid jargon. People get very into, particularly in the health community, terms that aren't digestible by the general public. So think about avoiding jargon and stuff that's inside baseball to you, and understand what a true soundbite is. If you've ever listened to the network news at night and you get the expert on there, hit your stopwatch and see how long their soundbite is. It's maybe 7 seconds, 10 if you're lucky. So what is your 10-second soundbite? And I also say it helps now with social media, with Twitter, to think about your message and characters. And always point out the human side of the facts. If you have a key statistic, what does that translate to in terms of the human side? Do's and don'ts. Do have 3 key points ready. KISS is the rule. Keep it simple, stupid. Educate, remember your target audience. Normally in communications, we say try around the 8th grade level. And always think of cultural sensitivities in messaging and multilingual delivery. Let me give you a good example there. So I worked a lot with the GW Mamma Van, which was a mobile mammography unit that went out in DC. And when it first started 20 years ago, we were primarily going into African American neighborhoods. The neighborhoods had changed by the early 2000s and much more Hispanic. And so we ended up using a patient navigator who spoke Spanish and also putting our messages on the side of the van in English and Spanish. Don't develop a laundry list of points. Your audience will glaze over. You need to be very concise in the points you want to make and save those talking points, that laundry list for your press kit. They can always go back and look at things that facts and figures, but when you're speaking with them or when you're doing an event, try to keep it really tight. Don't try to impress the media with your knowledge of the subject. It's education, but you can get lost in your own lecture and then the point is lost. Don't ever disregard your community sensitivities when speaking to particular subjects. And this happened a lot, recently with all the work that the health department has been doing with the African American communities and clergy in trying to overcome sensitivities about vaccination as they're pushing out the COVID-19 vaccine. They had to really listen to reasons why the underrepresented communities were not wanting to get vaccinated to develop their messaging campaign and decide who their messengers were. And always research your audiences and your approach. Do that first before you get started. So we're going to do a little interactive group messaging exercise. I want a volunteer to jump in and tell me, what's your elevator speech? Give me 3 key points that you want the media to know about your organization. So you can either unmute and jump in, or you can put your name in the Q&A for Lisa to read out.
That's an easy one for me. We're a chapter of a national organization called Sleep in Heavenly Peace. Our mission is no kid sleeps on the floor in our town. We've been in business for just a little over a year, and we've delivered 248 beds to kids in need. So we've gotten 248 kids off the floor. So bravo for us, and it's an easy mission to follow, and it's very focused.
So you really have your 3. Debbie has really encapsulated what you need to do in order to begin advocacy with the media. A really good pitch. Now, what else, Debbie, would you want the media to know? What's missing there?
I'm not quite sure off the top of my head, right? I need about $4,000 a month to stay in business. That's one of the things. But I also really need the media to bring the clients to us. We work with the schools and we work with social services, and those are our 2 main ways. Really, it's the schools, the flyers that we've put out there of how the families find us. But we still feel like we're missing someone. We've barely broken into the Hispanic community. We've just done a few. We have a gal that works with us as an interpreter, and will handle that portion for me. And so it's that we're still new. It's building the trust. It's feet on the.
Yeah, just a couple suggestions that I would have, because I think your elevator speech is fabulous. It's just, I think my question as a member of the media would be, well, how big is this problem? Do you have a statistic? One statistic, like how many people?
2 to 3% of the population is supposed to, of children are supposed to be without a bed.
Okay.
That's what our national organization gives us. We receive generally at least 1 bed request a day. We had a day in last February, not this, a year ago February, where we had 16 requests for beds. About 78% of our clients receive a bed. And so that's important, I think, to donors and to volunteers, that it's not, oh, just call up and you get a bed. So, some fall off the map, some don't fit into the age range of 3 to 17, some don't fit into our geographic location, so there's various and sundry reasons. But yeah, I have lots of different statistics and
Yeah,
pieces
so
of the puzzle.
I don't want you to do too much in your
Right.
speech, but in your press kit, if you were to develop a press, like I would say a one pager for the press,
Mhm.
a good way to approach that would be to have sort of a Q&A that you create. And it would be these questions. How many people are estimated to not have a bed? How many beds do you deliver a month? The scope of the problem. What is the need? How are you meeting it? Those kinds of things. Those are the things, but the top statistic that you gave me, I would put in your elevator speech and then save the rest of them for the Q&A, the little press thing. I would also encourage you to, as you said, you're getting a lot through the schools,
Right.
but think about the other nonprofits that are in our area that might, join in your effort. It comes to mind some of the groups that work with young women and girls. It might be a project for them to get involved with. Clergy might get involved because they may know people in their community that you don't know. And as you mentioned, getting the volunteers to crack the Hispanic community, getting the translation services that you need to reach communities with different language needs is another issue. Does somebody else want to jump in? That was really good, Debbie. Thank you. I appreciate you jumping in. So your 3 points, you want the media to know about your organization, and don't worry if you don't feel like you're as prepared as Debbie. This is for me to help you. So you can even jump in and say, I'm not really sure what to say, but this is what I do, or this is what we do.
I'll go.
Okay.
This is Melanie. So our organization is here for a reason, and our mission is to help eliminate the financial impact when living with or caring for someone with a disability. And there's over 40 million in the US that are living with a disability, and it costs an additional $18,000 per year for these households to have the same standard of living as a household without a disabled member. We've been able to help over 100 families in under 2 years, and that's the end, right? I would need to know what.
No, but you know what, that you have 2 statistics in your elevator speech, and they were good ones, right? So you've really made it tight. I want to know a little more about the human toll. You've got the economic toll. You've told me about, it cost 18,000 to bring a household up to basically code for that disability. But I noticed in some of your materials that I saw in the Nonprofit Institute's profile on you guys that you had a human story that was close to your heart.
Oh, yeah. Okay.
So your elevator speech needs to be, I've experienced this firsthand, right?
Okay.
You start with that. My nonprofit, we started 2 years ago, and we started it because I've experienced this firsthand. I think you're an authentic voice for your organization, your testimonial of what you've lived through, and really sparked you to create this nonprofit needs to be a sentence at the start.
Gotcha.
And then you go into a couple more of the salient points. And then I think you've probably got a lot of, like Debbie did, a lot of stuff that you can put in your little one-page toolkit for the media. Where you ask the questions, what does it mean to live in a disability, to live with a disability? What does it cost to support, the building, or et cetera, all those things. I always say to the person trying to create this, ask yourself questions you think people would ask you. And it doesn't have to be just the media, because remember, the part about media advocacy that's important is that you want to also engage the community. And that means fundraising as well. So what are the messages that you think funders would ask? Those are also important things to create in your toolkit, because if the media can amplify the need, So in your press kit, you can say, we've been here 2 years and we've been successful in raising awareness, but not so much in raising the funds we need to help each individual with this problem. Does that make sense?
It does, absolutely. Thank you so much.
Yes. Anybody else? And again, you don't have to have the perfect answer, but I think all of you, if somebody said, can you sum up my nonprofit in 3 points, you probably know them well enough to do it, even off the cuff. But I think you always need to think about this too. If you had to rotate those points for a certain reason, a certain audience, how would you do that? So again, the media is broad strokes. The community is broad strokes. Funders, a little bit more specific. Don't forget to use, as Melanie has in her nonprofit, authentic voices. If Debbie's working with people with kids and teens that don't have a bed, being able to spotlight the need through someone who actually got a bed is a very quick way to engage and to get it amplified by the media. So you can point the media to what you're doing and then also point them toward the story itself with the authentic voices that you'd like to promote. All right. When you are talking with the media, these are just a couple of points that I like to bring up to those who fear the media or who fear bad coverage, because it can happen. And a lot of times it happens because, as we know, newsrooms are really a lot shorter on staff than they used to be. But when you're talking with the media, don't repeat the negative when asked a question. And if you're stumped by a question, don't try to answer it in the moment. You don't have to. You can always use those transition phrases as you're trying to think about your answer. Well, that's a good question. That's an interesting question. And then you have time to collect your thoughts. Or, I've thought a lot about that question, while you collect your thoughts. If you're working with a colleague, have them run you through a mock interview. I always ask myself the questions that I think the media might ask, and then I ask someone who's working with me, can you play the reporter and let me be the nonprofit and let me answer these questions? It helps a lot. It helps not being tongue-tied. And as we mentioned before, be prepared to pitch the angle of the story beforehand. Tell the reporter also what your parameters are, what you're prepared to cover. And it's not out of the question to ask for questions in advance. Could you give me an idea of some of the questions you're going to ask? I always do that by email, because I think that can be very helpful. And then you have a little bit of a paper trail there. Some of them won't do it, but some of them will. And it's very helpful to you. You can say, I really want to be prepared. Can you give me just an idea of some of the questions you might be asking? And then you can also, during that exchange, give them some questions you might want to know. And if you can, before the actual interview, send them your press kit so they have all the information and they're not just fumbling at the last minute. Picking the right messenger is really important. It has to be a trusted source. As I mentioned, it could be your spokesperson, but I know I go over this a lot, but the authentic voices, very important. Very important. Finding someone who's actually been through this issue, who can speak. I'll give you another good example. We were working with Unity Healthcare in Southeast about introducing telehealth 2 years ago. Who knew we were going to have COVID, and telehealth is now the norm, but this was not the norm 2 years ago. And a lot of people in Southeast have transportation issues and couldn't get to the clinic for their regular checkups, which would just include a blood pressure check and a diabetes screening, and they would be spending $40, $50 a cab ride. So we were introducing with Care First a telehealth program for people who use Unity Health, and we were having this big press conference, and we were putting the agenda together, and somebody said, well, what do you think is missing? I said, we need someone who's actually used the service. It's great to have Care First say, oh, this is great. And the doctor to say, yeah, I can do it. But how about somebody who's actually used it? So we were able to bring 2 women in who had been using telehealth for 2 months for their regular health screenings. And it made all the difference in the message. And we got, I have to be honest with you, I don't think we would have gotten media coverage or Vincent Gray, who was the city council champion of healthcare, to come to that if we hadn't had the Ward 8 patients speaking. They were the authentic voices. Transitioning to Vincent Gray, if you have a policymaker that can actually come and speak for your cause, for your nonprofit, that's helpful too. And a champion. Who in the community can be your champion? I think it was Debbie. She was talking about working with the schools. So someone in the schools who can say, you know, this is just a great service, and we're trying to help the nonprofit identify people who don't have a bed. And then always remember that everything is local until it isn't. So some of the things that you're working on, I think Debbie's, you said yours was a national organization too. From the local up, your issue can be national, it can be regional, it can be international. Always keep that in mind. We've talked about this before, doing the legwork for the media, making your spokesperson available, providing the leads on the authentic voices. I have somebody for you. Also, you can help them by saying, hey, you can come film at the school where we're giving out beds or whatever it is. You know, telling them ahead of time so they don't have to go have a producer try to figure all these things out. Always provide a background and policy brief. Anything you can tie to prior legislative things or relevant issues. Obviously creating the media event like we did with the Care First and the telehealth thing. And then keep your social media accounts up to date. We're going to talk a lot about social media coming up, but if your social media for your nonprofit is up to date, then that's a good thing for the media and they will be looking at it. Remember that they have deadlines. Find out what they are and be mindful of them. Different media outlets have different deadlines, but I can tell you one thing, if you want to do a story on a Friday, great. Nobody does anything on Friday. Fridays are great times to do a press conference because there are usually no competition on a Friday. They need stories too. So if you pitch to them, and a pitch can be just an email saying, hey, just wanted to make you aware, our nonprofit this week is doing XYZ. In case you didn't know, here's some material about what we're doing. And persuade the media to help you. Free PSAs, placement of op-eds, frequency of letters to the editor on the relevant topics. I know right now there's a radio station in Fredericksburg that's doing free PSAs for nonprofits. We persuaded during the beginning of COVID at GW, we persuaded News 4 to do all of our COVID testing PSAs free. Not everybody was doing that. And I know I've said this before, but just remember your accuracy because they don't want to get it wrong. So you need to give it to them straight and right and be ready to answer any of their fact-checking questions. And again, when things don't go the way you want, don't be afraid to ask for a retraction. Hey, I gave you this information. You didn't get it right. And I really need for you to correct the record. To be sustainable, again, you want to keep your nonprofit top of mind. You have to adjust your campaign when you've met your goals or when you need to set new goals. Even building relationships with people that leave the media, if you stay in touch with them, they may know people who've replaced them, and that can continue the train of connection. And it is very tricky to navigate all these new medias and understand them. And so part of it is educating yourself on social media metrics, everything like that. Understanding the climate that you're working in. If it's a climate of fear, for example, in the early part of COVID-19, that had to be taken into account. It wasn't just cut and dry saying this is the virus and that's what it's doing. Everybody had to be ready to pivot and understand the climate of fear in addressing the messaging. If I were to say anything, at the beginning, that was a big mistake, not tapping into the community's fears. And then gut check your approach, and the tools to validate your results are always important. So really, what's at the root of it? It's what motivates your members. And knowing sometimes when going it alone is not the best route. Good example. I worked for the president of GW, and when he first came in, he recognized in, I think it was 2007, that a lot of high school students were coming in having done required community service in their high schools. He wanted to build a culture at GW of public service among the college students. So he was going to write an op-ed about it. And I said, well, okay, but you're one president. What if you were to get other presidents to sign on? And then what if you were to do an op-ed with the Partnership for Public Service and really push towards a National Day of Service? And that's what we did. We realized that just one voice was amplified in the media by joining with other nonprofits and other people in similar roles. And then you've got built-in events that you can work with. So if it's a health-related issue that dovetails with what your nonprofit is doing, think about the health calendars, think about relevant anniversaries, and always think about your messaging in terms of refreshing recruitment for people to volunteer with you, and staying in touch with the policymakers who may have helped you before. And just remember one thing, because all reporters are people too, and they have causes. They have things they care about. A lot of reporters have kids, they care about those issues. So being able to understand that they're people too, and they have causes. Truth serum, big bad media. Everybody's afraid. Don't be afraid to combat misleading information. Don't be afraid to look at what competing interests might be taking away from your media spotlight. Always be ready to defend your point and your organization with facts. Get your trusted sources out there as your final authority, and don't fall into the pattern of what I call information blaming. Oh, I'm not getting coverage because all this bad information is out there about what we stand for, and blah blah blah. The only way to combat that is through information sharing. And again, I would just point back to COVID-19 and how we were all sort of trying to navigate that in the beginning. All right, poll 2. Go ahead, Jennifer. Why don't you read that out?
Sure. How often do you use social media for your nonprofits? 59% of the respondents said every day, 23% of respondents said twice a week, and 18% of respondents indicated once a month.
Okay, thank you, Jennifer. That's telling. Let's talk about social media advocacy. It's obviously a strategy for building your network of advocates, and it's taking advantage of free exposure and marketing. It's building your strategy, and it's drawing on this strategy to affect change. It's a low-cost startup, and you get your messages out there quickly, and you find new opportunities to listen and engage and monitor your progress. But a lot of people make the mistake of either not doing it enough or not updating what they're doing. More voices than ever are weighing in, and that can provide some pitfalls for you. So there's a cluttered message landscape, and the social media platforms can become a site of rancorous debate. And sometimes in this environment, it's hard to get your message through. And that's why it's so important to determine your frequency ahead of time, the delivery you want, and the tone. So in setting up your social media campaign, just enlist your ambassadors, determine your frequency. It doesn't have to be every day, but it needs to be with some consistency. It needs to be something that your audience is, oh, I think I'm going to go check their site. Oh, they haven't posted in 2 months. What's current? You don't know. You'll know your group to know which messages apply on which platforms. Facebook and Twitter are totally sometimes different audiences. So you need to really know who you've engaged in your nonprofit and your volunteer network to see how to use the platforms. And a picture is worth 1,000 words, and so is video. You all have iPhones. Get that little video out there, post it. Somebody's going to click on that before they read. That's just how it is today. Make sure when you start a campaign that you have people lined up to retweet, repost, and like your comments, and obviously keep the messaging clean. I can't say this enough because, I just realized I had a misspelling in one of my slides. I'm going to have to go fix, but grammar and spell check your posts. If you see posts that are misspelled, the first thing you think is, well, who's working for that group? Also, try to feature multiple voices within your organization. And that's where you can bring in those authentic voices to do a tweet. Got my bed today. Can't wait to sleep in it tonight. Show redirects to trusted sources. What I mean by that is, early on when we were helping nonprofits get the word out about COVID, every redirect was to the CDC and their guidance. And then when you're using statistics, remember to try to use a source. So if you were using a statistic about, masks reducing transmission, where do we get that? CDC. Make sure that you keep clearing out your boxes. Delete your old posts and update with current ones. Always include your volunteers and employees. I always tell people, think about hiring college students to help with your volume. They're great at, helping you if you're not feeling savvy in this area, but grammar check, spell check on them. Keep an eye on your followers too. And when you're, using social media, establish the rules for civility and posting and responding, and then know what your analytics are. All right, more questions. And I know that Melanie, you had put in a very good question. Lisa, do you want to read that out so I can answer that?
Yeah, I'd be glad to. So Melanie says, she's from here for a reason. We've seen her before already. And she says, for social media, her nonprofit accounts are Instagram, Facebook, Twitter, and LinkedIn. They get good engagement on Instagram and Facebook, but she hears that Twitter and LinkedIn are the place to be, but we don't get good engagement there when we post. Any suggestions?
Are you using video on Twitter?
No video.
Use video on Twitter.
Oh, okay.
Use video. Just
And GIFs.
Yeah. Use the visual on Twitter. I'll be really honest with you. I have not totally come to understand LinkedIn and its global impact. I see it in the business world, how people connect. I think for you, it's probably more of a connection to other nonprofits than actually messaging. I could be wrong, but I think LinkedIn is still not being used as widely outside the business community for media advocacy as it could be. And I'm not sure exactly how that is solved, but I'm doing research on that right now, so I'm happy to keep you posted. But I think with LinkedIn, your best bet is to try to engage with other nonprofits and see what they're doing. And
Okay.
then
Barbara,
partnerships. Yeah.
Sorry. Teresa has a question. She says, what do you mean by deleting old posts? Is there a rule of thumb for how long a post should remain active?
I mean, when I talk about deleting old posts, when you're doing a progression of posts that rely on a certain fact and figure, if that thing has passed, then you should take it off. If it's fairly generic, as I call an evergreen, that will sort of last when something doesn't change, then you can keep it up there. So there's no particular rule. But if you're not posting regularly and you go on your site and you see one post for today and the last post was like 3 months ago, people are going to wonder about your social media savvy. But I say try to delete posts that have become not informationally correct anymore.
Thank you.
Yeah. Melanie had asked a question earlier about social proof. And is it viable for, do you want to repeat that question?
Yeah, I had asked, yes, the social proof question. I don't know if you were asking Lisa to repeat it or not, or I can just.
No, Melanie, please go ahead.
Okay. So yeah, I was asking about social proof because I hear, in the for-profit world, social proof reviews on Amazon used to reviews, but in the nonprofit world, is social proof a thing? And then how does that really help with the media? You kind of did touch on that, they may go
Yeah.
to social.
I mean, I think social proof is very relevant. I think it's your currency as a nonprofit. And I think how you build that in the nonprofit world, because you're obviously not going to do product reviews or things like that, but you need testimonials. You need testimonials. You need the authentic voices. I think you need people saying good things about your organization and what you're accomplishing. So I think social proof is really a currency now for nonprofits. How does that dovetail with the media? Let me give you a good example. So there was a New England nonprofit that really wanted to get people to reduce energy consumption during the summer months by using fans. So they put out this campaign and they said people were going to save about $54 a month if they did this. Well, interestingly enough, they went to the Wall Street Journal and said, we're doing this campaign. So the Wall Street Journal said, okay, great. We'll do a survey. We'll see how this works. We'll see what people are doing. They found out that 77% of the people who agreed to do this were doing it because their neighbors were doing it. They had sort of established the social proof. Meanwhile, the nonprofit got the Wall Street Journal engaged by talking about how, if they could get people to do this during the summer, they could be on this monthly plan where in the winter, where bills were so high, they could reduce those bills. So it was all a big circle, but it really did circle back to social proof and making people behave a certain way. And then, the media will pay attention to that stuff. Because as I said, they don't do the legwork as much as they used to. So they're going to look at stuff and say, oh, wow, well, they're doing this and they got this testimonial, and they may even look at one of your testimonials and say, can I find that person for my story? So I think social proof is really important in your world.
Awesome. That's very helpful. Thank you.
Lisa, any other questions that we have in our?
No, I don't see any more at this time, Barbara.
So I guess I'm a little early, 10 minutes early, but some final thoughts here. I think as we navigate a very tricky landscape, and I think what we're talking about too is just newspapers and the comment sections and debate in this country has become so rancorish on almost every issue you can think of. You have to think about that when you engage with the media, that there will be these platforms that they post on that have these debates, and there may be things that you don't like. And that's today's landscape. I do think that what has been an interesting phenomenon since COVID is that all the major networks have a segment at the end of their programming telling feel-good stories, telling stories about nonprofits feeding their communities, nonprofits delivering desks to kids who now have virtual school. So that is all about advocacy, people telling people about good deeds, and these good deeds finally reaching the top where the media outlets are saying, God, I'm really sick of just giving this bad news, so I'm going to end my section with some good news. So that is good news for you, very good news for you, because I think there's more of an appetite to mix up the coverage, to realize that there are good stories out there and people doing good things. And some of them have cropped up during the most desperate times. So, how do you get attention? Well, go local first. Get the attention there first, and then be very aware. Monitor all the different media channels, media outlets. There may be some that you don't want to work with, that you don't think would be in the best interest of your group, and you need to make that decision because things are polarized right now. So I would just say that. But I do think there is more appetite for the kinds of stories that your organizations can tell. So my big, takeaway from today is you are the best advocate for your organization, what you do, what you want to accomplish, and enlist your partners. Get out there and get the stories out there because I think they are using them more than ever before.